Welcome to the Dallas Duo Podcast,
your weekly wellness coffee date.
We're friends in Dallas, always looking for the best ways to optimize our health
and have fun along the way. Welcome back to the Dallas Duo Podcast. What if your next mammogram didn't hurt? Well, there's a new option that doesn't.
We are so excited to welcome brothers, Dr. Richard Reaven and Dr. Matthew Reaven, both co-founders of the Painless Mammogram, with decades of experience in diagnostic imaging, women's breast health. They're not only experts in their field, but they're passionate innovators who are committed to making preventative care more comfortable and accessible.
The Painless Mammogram is a Dallas clinic offering cutting-edge compression-free 3D breast imaging using FDA-approved Koning Vera technology. It's completely changing the way women think about their yearly screenings. And trust us, this is something every woman needs to know about.
Welcome, Doctors Reaven, to Dallas Duo Podcast. We're so honored to have you with us today. Let's start with the first question. What created and inspired the Painless Mammogram?
I've been working as a breast imaging radiologist for many years, about 15 years or so. I have been passionate about women's health and finding breast cancer at its earliest and most treatable stage. And there's lots of tools we have in our toolbox to accomplish that goal. And a lot of those tools that we have currently are flawed. And so I've been working with Koning, which developed the Koning Vera scan a few years ago. And it's very much innovative technology that finds a way to detect breast cancer at its earliest and most treatable stage without the need for painful compression. So I found this to be revolutionary, extremely exciting technology. And I decided to participate, get involved, and ask a bunch of questions, and decided, along with my brothers, to found this company that will bring breast imaging technology, the newest, latest, and greatest innovations in breast imaging technology, to the women of Dallas. And that's why we founded the Painless Mammogram just about under a year ago.
Wow. That's amazing. What makes this technology so different from a traditional mammogram?
So a traditional mammogram requires compression, right? As any woman who's had a mammogram knows, they come into the clinic, the technologist greets them, and in order to properly position the breast for the mammogram, the technologist literally has to pull and tug and squeeze the breast between two plates, which can be very painful, let's admit it. I deal with dozens of women every day in my regular practice, and each one of them talks about how uncomfortable the experience can be with a mammogram, and they're always searching for a better way. And so what Koning has developed is the Koning Vera, which is a much better way of imaging the breast without the need for painful compression. And what it offers in addition to that is truly three-dimensional imaging. So you may have heard a lot of talk about 3D mammogram over the past 10 years or so. It's actually a misnomer. As any radiologist or physicist will tell you, it's actually not a three-dimensional image. It's just a two-dimensional image that kind of sweeps from one side to the next, maybe about 15 to 20 degrees, and acquires a little bit extra angles around the breast without actually going all the way around the breast. So think of it like a slice of pie, right? You have the whole pie. If you take a little slice of the pie, you get a little bit more coverage than a traditional straight shot through. But what Koning Vera offers is the actual all the way around image. So the truly three-dimensional image going all the way around the breast, which offers much better imaging technology, much better spatial resolution, which we care a lot about in radiology. A lot more image quality when it comes to finding those early breast cancers at their earliest, most treatable stage.
I think that was my lead-up question, is the difference between 3D and not, the percentage of greater percentage of early detection, or what you've seen and the differences of those two?
Yeah, so there's been studies done, obviously, about this, and the FDA has approved this modality, which is the Koning Vera, for detection of breast cancer in the diagnostic setting. And all the data that's come out so far has shown that the traditional mammogram is good at finding breast cancers, but it has its limitations, and there are ways to overcome those limitations. And with the Koning Vera scan, we can actually offer superior sensitivity and specificity when it comes to detecting breast cancer. Sensitivity and specificity are ways that doctors talk about the accuracy of a test, right? How good is that test at finding the abnormality in the setting of sensitivity? And with specificity, how good is that test in ruling out the presence of that disease? So when it comes to breast cancer, we know that a mammogram, generally speaking, the sensitivity is around 75%, again, which is pretty good. In fact, 79% in most studies. With the Koning Vera, with the truly three-dimensional breast CT scan that we're offering, the sensitivity is up to 92%, which is significantly improved when it comes to cancer detection. And when it comes to the specificity for a mammogram is about 75%. The specificity for the Koning Vera scan is 79%. So as we can see in both those areas, the Koning Vera breast CT is actually able to deliver more accurate results when it comes to finding breast cancers and excluding those women who don't have breast cancer.
Okay.
Yeah. So I think about the families that we know that have like a strong presence of BRCA gene or have a really strong family history of breast cancer and are concerned and want the most data and the most accurate data as quickly as possible, and to know that for peace of mind, that this would be a great tool and solution for those individuals.
Absolutely. Yeah. For women with dense breast tissue or with strong family history of breast cancer, they're always looking for something else because there's been lots of studies documenting the limitations of traditional mammography. And we know that there are other modalities out there. We know that there's ultrasound, we know there's MRI. Those both have their limitations as well. And so when it comes to comfort and overall spatial resolution, improved spatial resolution, we really feel that this Koning Vera CT scan can really find a lot of those cancers that the traditional mammogram cannot find. And we're really excited about that. And we really think that this can offer a lot when it comes to the increased detection of breast cancer in this population, for sure.
I'm really thankful that I was able to just a few weeks ago actually come in and experience the clinic and the scan for myself. And
It was so organic. Like last year we had talked about, she was like, oh, I'm a mammogram. And I'm like, oh, what's that like? And she was like, it's horrible. And I was like, oh, you're so excited.
Yes, I remember telling you about that. And I'm, honestly glad that I had that experience because I have something to compare it to now, having this type of mammogram and just really seen the difference in just the comfort level and even just the experience in the actual clinic itself is like night and day as far as the level of care and even education. I learned so much just from being there and talking to the tech that day as well. So walk us through the experience. What happens from the moment a patient walks into the painless mammogram?
I do want to say, thank you for coming and sharing your experience. It is something that when we were thinking about, what do we want this clinic to look like? We had heard a lot from women about how much they, dread or they hate their, annual mammograms. They don't like, the sterile feeling of an outpatient imaging center. Everything feels cold, cheap. They feel rushed. They feel like they're being herded, like cattle. They feel like they're being poked and prodded and squished and squeezed. And we really wanted to make this a much more comfortable, relaxed, almost spa-like atmosphere for women, so that an event that normally they, would dread and really hate could actually be something that they, might even enjoy going to, bring their friends with them, and have a much more relaxed feel. So when you walk in to the painless mammogram, obviously, you're greeted from our, our front desk, our receptionist. She'll have you fill out a couple forms, just, general information. Space is very comforting, very warm. We have some nice background music playing. You'll be offered something to drink. At that point, you'll go and change into a nice kind of a little more premium, robe, not one of those like cheap, paper robes.
Very impressed by the dressing area. It's all very pretty, I must say.
Yeah. Yeah, I mean, that was very intentional. We spent a lot of time and effort in making sure that it was visually appealing, it was comforting to really, reduce the anxiety and the stress level as much as we possibly can for women, for like something that's otherwise, a very stress-inducing experience otherwise. And so, once the woman is in their robe, they'll be escorted from our, biotechnologist into the imaging room with the Koning Vera. The woman lays flat. One breast is suspended through an opening in the machine, and just simple gravity suspends it. There'll be some positioning, just making sure that the breast is, kind of the center of everything. And then once the positioning is good, the technologist will start the scan. It only takes 7 seconds for the scan to go all the way around the breast, and then that breast is done. And then you just, flip it and do the other breast. Same thing, get it positioned, 7 seconds to spin, and then you're done. So after that, the woman can get off the machine, go change out of the robe, back into their clothes, and they're off for the rest of the day. So the process usually takes about, 15 minutes from the time that someone walks in until the time they walk out. And we've had really good reviews from our patients who really appreciate, the information they're being provided from our technologist. They appreciate the experience, the warmth of the place, the fact that we are not rushing, women through. We're not squeezing them, compressing their breasts at all. We've had really, really good, positive feedback from all of that.
What is because I don't know, I actually haven't had a mammogram. I feel like I've had everything, but not that. What is the difference in time and turnaround time of testing versus traditional mammograms?
So traditional mammogram takes a little bit longer to acquire because there are two images performed on each breast. There's what's called the CC view, which is kind of the above and below view, and then there's the side-to-side view. And those are each done of each breast. And sometimes there needs to be some repositioning, right? Because let's say the technologist didn't get everything they needed to get in the original view, then they need to take a second view. And that'll increase the radiation, that'll increase the time that the experience takes. So the whole process takes probably about 20, 25 minutes altogether. With the Koning Vera, we can do it a lot quicker because we're only doing one acquisition or one scan of each breast. And we don't need to do any repeats because the positioning is basically just based on gravity. It's not based on the technologist pulling and tugging and squeezing. So it's a much quicker time to actually take the images. When it comes to turnaround time, it's a great question. A lot of it depends on the volume of the place where they're doing the studies and also the technology and the ability of the radiologist to interpret the studies. And what we've been telling patients for the first few months is it's going to take a few days to get the results back, maybe up to a week. And a lot of times that's because we are waiting on prior studies from other facilities to compare to. But if there's no prior studies, it should be read in a few days, I would say.
Yeah, that was one thing that really stood out to me in my experience was really how fast it was, and also that the technician didn't even really have to touch me. She really was just very good in her directions on what to do. And I also love that before I even got on the table, she used a placeholder to sort of show me what was going to happen. She showed me what it was going to look like on the screen. And so I thought all of that was, just really helpful and informative.
So it's the painless, touchless.
Yeah,
Right.
honestly.
We want to make this as painless as possible. And we know this technology, we really let the technology speak for itself. And when it comes to having no discomfort on behalf of the patient and no pulling, squeezing, tugging on behalf of our technologist, she can really just position you from remotely, basically, and from the other side of the room, and then start the scan, and everything is done very quickly and get you up off the table and back to your day as quickly as possible. So we're really focusing on the flexibility and the overall pain-free, comfortable experience. But at the same time, we have the added bonus of the added benefit of the increased detection rate, increased accuracy of the test compared to the traditional mammogram. So we really think we have both angles covered very well here. And I'm going to add one more thing. We know that there's a lot of women that have breast implants. And in the implant population, this technology is far superior to the traditional mammographic experience for a few reasons. The first is that in a woman with breast implants, when she comes in for a traditional mammogram, she will not only get the regular views, meaning the traditional CC and MLO views, or the top to bottom and side to side views, but she'll also get what's called the implant displaced views, meaning the technologist literally has to push the implant back against the chest wall and take another set of images with even more compression, more discomfort to the patient, more radiation to the patient. And she ends up taking two sets of images, one with the implant in place and one with the implant displaced. So that contributes to even increased discomfort to the patient, increased radiation, increased number of studies, increased time that it takes to perform the examination. With the Koning Vera, we're able to do all of that in one fell swoop with 7 seconds, without the need for implant displaced views, without the need for extra views, without the need for extra radiation. And in addition, for women that have breast implants, there's actually FDA recommendation to evaluate the implants every 2 years to make sure that they're not ruptured, because implants can rupture. We know that. And it's important to get those checked every 2 years. With a traditional mammogram, that is not possible. And so there needs to be additional imaging performed to assess for or check for whether or not the implant is intact. And traditionally, that's been MRI, which is very expensive and has a lot of other limitations when it comes to claustrophobia, cochlear implants, pacemakers, the whole 9 yards. With the Koning Vera scan, we've shown that we can actually not only make the process a lot more comfortable for the patient, but we can actually evaluate the implant to see if it's ruptured or not in a routine scan with that same 7-second painless breast CT evaluation. We're able to find all of those things in one fell swoop of 7 seconds without the need for additional imaging. So it's really helpful for the implant population. And it's something that women with breast implants should be very much aware of.
That was something I was really interested to learn during my visit as well. The tech pointed out that, if you're having a traditional mammogram, it's about the same level of radiation that you're getting, if you don't have implants. But if you do, you're actually getting 50% less, which I thought that's
Correct.
actually a really big deal and something that people would be interested to know as well.
Absolutely.
It's a huge deal. And I mean, on a personal note, my wife has breast implants. She's not of the age yet, she's not 40 yet, but she told me prior to all of this that she would never get a mammogram. I mean, she never had a mammogram. She would never get one because she was so afraid of compressing the implant, rupturing it, altering the aesthetic of it, moving in and so forth. And, 1 in 8 women get breast cancer, regardless of if they have implants or not. And so women with implants are not getting their mammograms, but they're still going to get breast cancer. And so if they don't detect it early, it's going to show up, late when it's already very large and may have already spread and treatment options are limited. And so now we have a way very, very easily, very, very quickly to scan these women with breast implants with absolutely zero risk of implant rupture and zero risk of in the implant or change the aesthetic appearance of the implant. So, just on a personal note, that's obviously very important to me and, all the women across the country who have breast implants.
Yeah, the traditional mammogram seems like such a lose-lose scenario because you increase your rupture risk, but you also increase your time there, decrease like so many different parts of that process just become more like anxiety and fear ridden and kind of decrease your confidence in the process. And so that trade-off is invaluable, I think, to know that that exists.
Right. There's actually a lot of women, not only with breast implants, but especially with breast implants that avoid a traditional mammogram for a lot of these reasons we're talking about. If you look at the national data, there's about 80 million women in the country that are above the age of 40. And there's only ever been about 39 million, so most of the time it's 35 million mammograms performed each year, which means that there's almost 50 to 55% of the population that's not getting a mammogram on a regular basis. So they're still experiencing breast cancer. We're just finding it at much later stages. And so what we advocate for is for women to come in and have their breast imaging study performed in a more comfortable environment that doesn't require all that pain and discomfort that's associated with a traditional mammogram. And we know the breast cancers are out there. It's our job to find them. And we're very excited to offer this additional tool in the toolbox that can really find those breast cancers that are not currently being detected.
Yeah, I think that, our population is really interested in like health hacks and health optimization. And what I talk about a lot in my practice is what can we do just to gain more knowledge? And any baseline trend is such a powerful tool, whether it's, your insulin levels never been checked or A1C or thyroid or whatever it is. But like, how can we get that data sooner than later with the least opposition possible? And so my question was in regards to like referrals. Like a patient doesn't need a referral in order to come have the mammogram, correct?
Yeah, at this point in time, because of the insurance issue that we're working on dealing with right now, we are not requiring a referral from a doctor. Now, at this time, we do require that every patient that comes in notifies a primary care doctor or OBGYN or gives us the name of a primary care doctor or OBGYN, because if we find an abnormality, we'll need someone to follow up with when it comes to working that abnormality up, getting a biopsy, getting additional imaging, what have you. But when it comes to the insurance situation, once we start dealing with insurance companies, we actually started dealing with insurance companies already, and we'd be happy to take insurance today. In fact, we have submitted applications to about all of the insurance companies in the state of Texas, about 18 of them, the largest ones, months ago, and we are currently waiting to hear back from them. So we'd be happy to deal with insurance companies and take insurance companies' patients right now. We're just waiting on them to kind of get back to us and make sure that the numbers work out, ensure that the reimbursement is fair for what we're offering. And so we are currently undergoing those negotiations right now. And when we start submitting bills on behalf of the patients to the insurance companies, at that point, we'll most likely require an order from a doctor in order to perform this test until such time that the FDA approves the technology for the screening indication, which should be pretty soon.
Yeah, on top of that, even now, if patients, they come in, we can provide them with a super bill
Oh, that's what I
that they
wondered.
can, submit on their own behalf to their insurance company to try to get reimbursement that way. We can't guarantee, if they'll get anything or what they'll get. We have had patients, anecdotally, get some of that money back. We just can't make any, obvious promises because it's so, dependent on the patient's circumstance and their insurance and so forth. But that is something we can provide patients, at least that they can, submit on their own behalf and potentially get some reimbursement for it.
Yeah. Well, we know that insurance companies are very rapid and efficient in their review of
Right.
new
Yeah,
interventions.
what I'll say is that whenever there's a new technology of any sort, the insurance companies take some time to kind of wrap their minds around how they're going to work it into their patient population. And so we understand that, and we're willing to work with them. As I said, we've submitted applications. We're waiting on their responses so we can start that negotiation process. And we do think that insurance companies will come around to figuring out a way to make this work for their patient population, because we know that it'll be very effective and helpful for their patients to be scanned in one way or another for breast cancer, because if they don't, they're going to be dealing with more problems down the road. And so what I could urge your listeners or your viewers is, if they feel like their insurance company needs to start paying attention to this, give them a call and let them know that we are willing to work with the insurance companies and figure out a way to get this covered. We basically just need to get this technology in network for the insurance companies. And we're happy to do that whenever they want.
So I have a question. Is this technology in your clinic, it's the only one in Texas right now? Is that correct?
That is
That is
correct.
really exciting. Are there plans to expand beyond Dallas or beyond Texas?
Yeah, we decided to start here in Dallas. I think the plan is to eventually have more clinics throughout the DFW Metroplex, because it's a very large area, 8 million or so people in the Metroplex. So yeah, we can definitely expand through the DFW area first. And then I think after we have a good coverage of the DFW Metroplex, at that point, we'd be ready to, expand to other cities in Texas.
I feel like it's a similar market to like Prenuvo, right? Like you have individuals who are very forward thinking when it comes to wellness, proactive. They're interested in getting answers sooner than later, not waiting for something to develop. They're interested in new technology. So I'm excited to see where you guys expand to.
Absolutely.
As another anecdote, we've actually had patients from Prenuvo who have had a whole body MRI, whole body non-contrast MRI, and they see something, in a breast. A non-contrast whole body MRI is not, a diagnostic quality for the breast. And so they've come to us and have gotten their, the painless mammogram with us to really, dig into it and see really what that is. And yeah, I mean, certainly patients who are, really in tune with their health and really want to be proactive about their health and making sure that they stay on top of their preventative maintenance. This is a great option because number one, it's completely painless. It's extremely quick, and has a higher, as Rich said, a higher sensitivity specificity than traditional mammography. So women know that they're getting the best possible diagnostic quality image.
Interesting. So powerful. Our listeners, I think, are within this specific demographic. So when you encourage women and individuals on how often they're doing this, is it the same recommendation as traditional mammograms in terms of follow-up?
Yeah, I think when it comes to getting a yearly imaging study, this will follow the same pathway as a traditional mammogram, basically meaning every year above the age of 40. There are certain indications for use before that time, especially those with breast implants or those with elevated lifetime risk of breast cancer. They tend to start a little bit earlier than 40, but yeah, generally speaking, above the age of 40 and every year. That's the best way to really make sure that the breast cancers don't have enough time to grow, and we can find them when they're early, when they're early stage, when they're at their most treatable stage.
Yeah, I think that that is actually some of the most powerful data is like early stage outcomes versus late stage outcomes for women. I don't think people realize how drastic those numbers are.
Absolutely.
When I just think it's also really important to just talk about it amongst our friends and to share this type of information. Even from the reel that I did and what I've been sharing about it, people are really curious about it.
Absolutely.
Any final messages, words of wisdom for women listening, like anything that you would share as kind of your inspirational tagline, elevator pitch for the painless mammogram?
Matthew, you can go first, and then I'll go after you.
We know that the traditional way that mammograms have been done for the last 50 years has basically been unchanged for the last 5 decades. Some women tolerate just fine, and that's wonderful. But we definitely know that a lot of women really hate the compression, the tugging, the overall experience of traditional compression mammograms. And we also know that a lot of women, because of that, don't even get any breast imaging. And so we're really excited to be able to offer this, new technology that can provide patients with completely painless, completely compression-free, really fast, easy method of detection that is actually better as far as early detection than traditional compression mammograms. We just are so excited that we finally have a better way to perform mammograms. We have gotten such great, positive feedback from all of our patients so far. We've had women cry because they're just so happy there's finally a better way. And we're just really excited to bring this better way, to the women of DFW.
As a practitioner, I see this all the time is that cancer is a really scary thing. It's a very scary word. And so the idea that there is diagnostic criteria, diagnostic procedures now that exist that are painless is such a rare opportunity. I think of how many areas require really heavy interventions that are painful in order to discover cancer, and how this isn't. Like, how incredible that has become such an innovation that you guys are providing.
Absolutely.
Yeah. And what I would say is, understand your options. It's important for women to be an active participant in their medical care and to be aware of the options that are out there. And obviously, getting breast imaging is very important because we know how common breast cancer is. 1 in 8 women will develop breast cancer in their lifetime. And that's a really high number, which is why it's important to be aware of your breast health and to understand your options when it comes to breast imaging. And when it comes to personalized medicine, especially, not everyone fits in the same exact model as everyone else. And so for those women that are looking for a different option or looking for an alternative, just understand what the options are and come visit our website at thepainlessmammogram.com and send us an email, ask us questions. We're happy to share with you the technology and what we could offer at our clinic. And we'd be happy to schedule you as a patient, and we'd be happy to participate in your overall care and bettering the women's health of the DFW area, where that's what we're trying to do here. So we have a lot to accomplish. We have big goals, but we think that we are well prepared and we have every intention to do exactly that. So we're very excited, and we hope you'll come learn about us and visit us. Tell your friends.
I will definitely continue to recommend this to all my friends, having experienced it myself. I truly believe this is the future of preventative care. And I think y'all are doing a wonderful thing. So thank you so much for joining us today.
We know that you aren't looking for business advice, but I did catch you say you wanted it to feel like a spa-like experience. So if I can recommend foot massage or hand massage upgrade options, maybe some like
a manicure while you're there.
Like there is a big market available for you in your future.
We can look into that as well. We can link to that as well.
Well, thank you so much, Andrea. Thank you so much, Whitney. We really appreciate your time.
Thank you
and
so
bringing
much
us on your podcast. We really hope that this has been helpful for you and helpful for your viewers and your listeners. And we'd be happy to answer any questions that anybody has.
Yes, we're excited to share it. Yeah. Thanks again.
Thank you.